Welcome to the SRTA Dental Examination. Before we begin, SRTA would like to wish you all good luck on this examination and in your professional career. This orientation highlights the policies and procedures which a dental candidate must follow when taking the SRTA dental examination. You may refer to the candidate manual for more detailed information. Part 1. Policies and Protocols. You should only have contact with the clinic floor coordinators. This is an anonymous examination, and all evaluations are done by the examiners off-site. SRTA authorized observers are dentists or dental hygienists that may be present at any examination. Observers will wear an identification badge throughout the examination. At least one clinic floor coordinator, CFC, will oversee all examination procedures and facilitate a smooth and stress-free examination. The CFC is not an evaluation examiner, but they may address any non-graded area of your work. The CFC will answer any questions you may have as the examination proceeds. Please do not hesitate to ask. You may keep your candidate manual with you during the examination and refer to it as needed. Notes written in your manual are permitted. However, charts, graphs, picture designs of preparations, etc. may not be taken into the clinic. The use of cell phones, cameras, pagers, and any other electronic devices are strictly prohibited. Although this is a completely mannequin-based examination, CDC-based guidelines for infection control must be followed during all clinical procedures and when setting up and cleaning your assigned cubicle. Protective eyewear must be worn by you during clinical procedures. Penalties may be assessed by CFCs if violation of barrier technique or patient management occurs. If you experience any equipment failure, contact the CFC immediately. If repairs cannot be made promptly, you will be assigned to a different operatory. No chairside assistants are permitted during the non-patient examination. Upon entering this orientation, you received a white envelope with a peel-off ID label with your candidate's sequential number on it and identification badge clipped to your packet. You may now open your candidate packet and review all materials. Please check to make sure that your sequential number on the peel-off identification label is correct. Do not forget to bring your packet and its contents, as well as your identification badge to the examination to which you were assigned. The packet contains cubicle cards, progress forms, peel-off ID labels, candidate check-off form, and a manila folder for each restorative and periodontal procedure. Place a peel-off identification label in the provided space at the top of each progress form. When you receive your cubicle assignment, enter that number in the provided spaces at the top right of your progress form. The progress form provides an opportunity to make notes or comments regarding the typodont's physical state. All forms should be written in ink. Comments should be brief, and they must be reviewed by a clinic floor coordinator before proceeding. The entry of the CFC's PIN does not necessarily indicate agreement with the comment. Upon your conclusion of the examination, refer to the candidate check-off list in your packet and turn in all the indicated forms as directed by the clinic floor coordinator. Candidates must turn in all the forms for each part of the examination you are assigned to. even if you didn't take or complete that section. If all required examination materials are not turned in, this will result in your score not being available or reported. Your results will be available within 10 business days from the examination date. Scores can be viewed by logging into the SRTA Candidate Clinic portal, using the password and username that was created during the online registration process. The results of your performance will be reported to SRTA member states. Part 2. Restorative and Periodontal Examination. Exam schedule for PI 2 and traditional examination. Candidates should set up and complete all required paperwork with the CFC's approval PIN before beginning any work. Beginning at 8 a.m., the examination will start, and candidates may manage their own time on the restorative section. Candidates will have 6 hours total to complete both preparations and restorations, and 2 hours for the periodontal section. The following slides will review the restorative section of the examination. The 2 restorations are graded as separate examinations rather than 2 parts of the same examination. Interproximal contacts of this tooth are extremely tight, and the use of a wedge may be necessary to place a strip in between. The use of hand instruments is permitted, such as spoon excavators. However, excessive pressure may result in chipping of the cavo surface margin. Please be cautious when utilizing hand instruments. All restorative teeth will be approved and entered into the scoring system prior to the start of the examination. Candidates will complete 2 preparations, one on an anterior tooth and one on a posterior tooth. Upon completing the 2 preparations, please see the CFC to receive the next pair of teeth to restore and to obtain a finish time. Candidates will be prepping 2 teeth, followed by restoring 2 different teeth. Do not restore the 2 teeth you have initially prepped, as this will prevent examiners from evaluating your work and will result in a failing score. All restorative procedures must have an isolation dam in place while performing any work. Modifications. If, in your judgment, once an acceptable preparation has been achieved and the preparation needs to be modified to allow complete removal of caries or decalcified enamel, then a modification must be reviewed and approved by the CFC. It is especially important to request a modification if you appropriately anticipate a possible pulp exposure. Important note: if you have a pulpal exposure, you must have the tooth properly isolated and must notify the CFC immediately. All restorative procedures must have an isolation dam in place while performing any work. For the restorative examination, your progress form must be completed and ready for the CFC to review. When starting the posterior restoration, you must have the paperwork completed by circling 2 of the possible posterior restorations options. The following slides will now review the periodontal section of the examination. For the periodontal exam, a CFC will review the progress form and issue a finish time. The allotted time for the periodontal section is 2 hours for treatment. If you wish to start the periodontal section immediately or soon after completing the restorative sections, you may contact the CFC to obtain your periodontal typodont and be assigned a finish time. You must receive a start time of at least 45 minutes prior to the end of the examination day. If you have less than 45 minutes to complete treatment, you will not be allowed to begin the treatment procedure. All procedures must be completed and turned in by 4 p.m. of the examination day. Candidates will be assigned teeth to probe, detect calculus, and a quadrant to scale. Complete the periodontal pocket probing and calculus detection on the assigned teeth prior to starting any scaling treatment. All plaque, supragingival, and subgingival calculus must be removed from the entire crown on all of the teeth of the assigned quadrant. When treatment is complete, contact the CFC for approval to dismount your typodont. Part 3. Restorative and Periodontal Questions. Part 4. Endo and Fixed Pros section. Note: it is recommended that only air spray be used during these examination sections. However, if permission has been granted to use air and water spray, a mechanism must be in place to collect and remove the water. Exam schedule for PI 1. The following slides will now review the fixed prosthodontic section of the examination. The procedures to be performed are full cast metal, all zirconia crown on tooth number 3 as the other abutment for the same 3-unit bridge, PFM crown on tooth number 5, one tooth of a 3-unit bridge abutment, ceramic crown on tooth number 9. Mark the teeth to be prepared prior to beginning any of the fixed prosthodontic procedures. Verify that you have marked the correct teeth. A reduction guide must be fabricated prior to starting the fixed prosthodontics examination. You may do so once you have received the fixed prosthodontic sextants. Reduction guides may be done without the use of gloves prior to typodont mounting. You may also use purchased, manufactured reduction guides. Other impressions may be taken during the exam using appropriate infection control procedures. All impressions, casts, stints must be turned in at the conclusion of the examination. No isolation dam is required for the crown preparations. If the simulated gingival margin is recessed below the CEJ, prepare the margins to within 0.5 millimeters of the CEJ. The lingual margin for the PFM crown should be prepared for a metal margin, 0.5 millimeters. The transition from the facial shoulder to the lingual margin should begin to occur at the interproximal buccal line angles. The tooth for the PFM crown should be prepared for a porcelain occlusal surface with an optimal occlusal reduction of 2 millimeters. For the full cast gold crown preparation, the occlusal reduction is optimally 1.5 millimeters. No equilibration will be permitted on the typodont prior to or subsequent to any crown preparations. To taper is defined as to gradually become more narrow in one direction. Requirements for tapering are shown below. When you have finished, contact the clinic floor coordinator. Place peel-off candidate label on the poly bag and put stints inside. The CFC will take your poly bag to the evaluation area. The following slides will now review the endodontic section of the examination. Radiographs will not be used during this section as the tooth length is measured prior to the start of the procedure. Follow the procedural steps as listed on the endodontics progress form. Make sure you obtain a CFC number in each box. The procedures to be performed are access opening, canal instrumentation and obturation on anterior tooth number 8. The candidate must fill the canal with the appropriate size gutta-percha cone. Access opening on posterior tooth number 14. The candidate must achieve direct access to all 3 canals. It is the choice of the candidate to start treatment on either of the endodontic teeth number 8 or number 14. The candidate may proceed to the other tooth without permission from the clinic floor coordinator. The use of an isolation dam is required for the endodontics procedure. A single dam may be used to isolate both teeth simultaneously, or separate dams for each tooth. No isolation dam may be applied prior to 8 a.m. Do not place an isolation dam clamp on tooth number 8 or tooth number 14, as doing so may cause the crown to separate from the rest of the tooth. On the anterior tooth, the use of warm gutta percha or carrier-based thermoplasticized gutta percha is not recommended for use, as this may damage the plastic tooth. If the anterior endodontic tooth fractures during filling, treatment should be completed. If the crown fractures during treatment, contact the clinic floor coordinator immediately. The cemento-enamel junction, CEJ, on the facial surface should be used as the reference point to determine the fill depth in the pulp chamber. No temporary filling material, cotton pellet, or restorative material should be placed in the pulp chamber. Place a peel-off candidate label on the manila-colored string tag and affix the tag to the hinge area of the typodont. Place your typodont progress form in the original packing box along with the bubble wrap. Part 5. Endo and Fixed Pros Questions.